Hi there everybody and welcome back to my channel. Today I'll be talking about viral conjunctivitis, which is actually more common than bacterial conjunctivitis. So if you want to learn more about this, then please stay tuned. The conjunctiva, which is the thin film that surrounds the white part of our eyes. When this gets inflamed, you get conjunctivitis, and you can get characteristic symptoms including a red, uncomfortable, gritty eye. Depending on the cause of the conjunctivitis, the discharge you get from the eye will differ. So it can be a thick, greeny, yellow discharge, classically if it's a bacterial type of conjunctivitis, or a more watery discharge if it's viral conjunctivitis. Viral conjunctivitis is actually more common than bacterial conjunctivitis, and that is why I thought I would make this video. In terms of viral conjunctivitis, patients will commonly describe that they have recently been unwell, and that could have been a sort of cold or cough or nasal symptoms, and then subsequently that virus has gotten onto the surface of the eye and caused a viral conjunctivitis. The eye may look markedly red and it can be quite disconcerting, and what will happen is, if proper hygiene practices are not followed, the second eye becomes involved fairly quickly. If the front of the eye also becomes involved, i.e. the cornea, then vision may also be reported as being blurry by the patient. Viral conjunctivitis is usually a clinical diagnosis that one can make through a careful history from the patient and a careful examination looking at certain pertinent signs and features that may be present. Once the diagnosis has been made, the first thing to do is reassure the patient that this will get better, but it can take slightly longer than a bacterial conjunctivitis. Secondly, the fundamentally important thing that one must do is educate patients about the risk of contamination, firstly to the second eye, and then subsequently to family and friends that may live with them or people that they mix with either in work or socially. Viral conjunctivitis can be spread from person to person through poor hand hygiene practices, or using an infected towel, or using eye makeup, or using drops that may be also contaminated. So that's why it's important to educate patients about these risks so that they can try and minimize, if not eliminate them completely. Whilst the patient's eye does feel uncomfortable, you can provide them with ample amounts of lubricated eye drops, and they can also use cold compresses to try and help to alleviate their symptoms. The condition can take up to 2 weeks to resolve, so warn the patient about this so that they can have a realistic timeline in their minds. If you like this video, then please click the subscribe button, the like button, and the bell icon.